for Omicron, since most of the individuals are having a less severe illness, most of these people can be treated at their own homes. So, what we do advocate is something called prompt self-isolation. The moment you detect symptoms which are like a common cold, like a runny nose or a fever, a bit of body pain, headache, etc., and if others in your contact as well are having similar symptoms, it's very, very likely that you picked up Omicron. And rather than immediately rush to the lab for a test, we advocate early and prompt self isolation because, as Dr. Priya Abraham said, we need to stop the spread of this virus. And rushing to the lab is not going to stop the spread of the virus. Keeping yourself away from other people for a few days is the best strategy. Now, so self isolation is one. Testing is required uh, on a prioritized basis, particularly for older individuals, and we will come to that at a later part of this talk. In terms of what to do at home, it is important, firstly, to understand that our body has the ability to fight off this infection in most instances. So, in other words, there is no need for an obsession for pills or injections to get rid of this virus. I'm talking about mild cases that are in healthy individuals who are being treated at home. What we must pay attention to will be hydration, which means that we need to keep ourselves well hydrated, drink plenty of water, make some ORS, which is oral rehydration salt solution, which is easy to make because the body, when it goes through an infection, particularly something like COVID-19 at home, tends to get dehydrated, which means you get weaker, your muscle strength comes down, you feel so tired you can't get out of bed. Sometimes this itself may result in hospitalization. So, early treatment of dehydration with plenty of fluids. You could make your own ORS at home. You don't have to buy packets, which may incur a cost. I'll tell you how to make it. Just take 5 cups of water, regular water, drinking water. Add a pinch of salt. That is a half teaspoon, the smallest spoon, half of a small spoon of salt, and 6 level teaspoons of sugar. Mix it well, and you could use it for a day. So, drinking oral rehydration when you're having high fever is a must because that will keep your strength up. It's like watering a plant which is wilting in the sun. So, that's one. Second is if the fever is very high, you could take a paracetamol according to your body weight. For most adults, 650 milligrams will suffice. 1 or 2 tablets a day will suffice. No more than three, at the most four. The third is that it is better to stay away from all sorts of fancy treatments which may be dished out in the name of treatment. Unless there is a specific indication, there is no need for antibiotics, including for things like clarithromycin or azithromycin in mild cases. The doctor will tell if there is a bacterial infection. If there is a bacterial infection, yes, that's in a very tiny minority of individuals who will need an antibiotic. It is important to sleep well, stay away from scary news, try not to read scary articles about the illness while you're having it, get a reasonable amount of good home cooked food, which is easy to digest, and listen to the doctor's instructions. Stay in touch with your healthcare provider. For somebody, it may be the ASHA worker, or it may be your local primary health center, your family doctor, or any practitioner that is in charge of your health. So those are things that anybody can do. Now, in terms of hospitalization, people who need to go to hospital for more severe cases, the treatment is largely the same as that of Delta. The only slight difference is in the use of an agent which is called monoclonal antibody. Now, these are antibodies that are artificially made, which attack a few points of the spike protein of the virus. Dr. Abraham mentioned the spike protein. If you imagine the spike protein to be a mountain, there are a few rocks on the mountain that are targets of antibodies. Now, Omicron has changed a few rocks around. So, which means that the original antibodies that were created to hit these rocks are not working anymore. But the mountain is still the same, which means vaccines which are made to fight the whole mountain are continuing to work against severe disease. But these antibodies, which are monoclonals, are not working against Omicron. So the products that are available in India are no longer effective against Omicron, and the US FDA has already um, sent out a warning about that as well, that it is no longer effective. All other treatments are the same, pretty much the same. And our Ministry of Health and Family Welfare has put out evidence-based guidelines, having discarded all forms of treatments that are not effective. So the guidelines are available at the Ministry of Health and Family Welfare website and are divided into three categories: mild, moderate, and severe. And it's very clearly written.